Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care. Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the privilege of sitting down with Kathleen Loredo and Dr. Anshul Dixit. Kathleen represents Vivant Health in the greater Sacramento area, and Dr. Dixit is the Regional Medical Director for the greater Sacramento area for HealthNet, a managed care organization serving over 2 million individuals throughout California. In today's episode, we learned how Vivant and HealthNet have come together to really impact their members and patients coming out of the Dignity Health hospitals in the greater Sacramento area, and the power of having a community-based organization like Vivant have a local connection with the patient that they trust, the patient trusts, and can make a great impact on reducing hospital stays that are unnecessary. We hope you enjoyed today's episode. Feel free to check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com, checking us out on our YouTube channel, or listening to us wherever you listen to your shows. Thanks, everybody. Enjoy today's episode. Hello, Kathleen. Hello, Dr. Dixit. Thanks so much for joining the show today.
Thank you for having us.
Absolutely.
Thank you for having us.
You're absolutely welcome, and I really appreciate the time. So before we jump into talking about your partnership there in the greater Sacramento area, we want to talk a little bit about you guys. We like to get to know our guests a little bit. And so let's start with you, Kathleen. One of the things we do when we kick off our shows is a fun fact, something maybe outside of the workplace. We'll start with you.
Okay. I always call this the Rumpelstiltskin question because nobody can guess what my favorite hobby is bow hunting.
Bow hunting. Okay.
Very surprising for most people that hear that. It was up until about 5 years ago. I tore my rotator cuff, so I'm not able to do it anymore, but I really did love to bow hunt.
So is bow hunt, I'm thinking archery, but am I way off?
Yes, you are correct. Archery.
Okay.
Compound bow.
I have hurt my hand many times trying to shoot. Actually taught archery to kids just at a summer camp. So, and I took a class in college, but I'm sure I know nothing compared to you.
Yeah, it's a lot. And most people are against hunting, but I figure if you can get into an animal's home in their environment and get within 20 to 30 yards, you're pretty good. And you deserve that shot because it's very difficult. So.
Wow.
Yeah.
All right. That is definitely the Rumpelstiltskin. Still, I haven't heard that name in a long time, but I
know.
That is awesome. How about you, Dr. Dixit?
Well, that's a tough act to follow. Precision, accuracy, and athleticism all combined into one. So kudos, Kathleen.
Thank you.
I'm a gardener at heart. Okay. Something that I took from my dad. So if you come to my house, you'll see this time of the year, strawberries, kumquats, and maybe the occasional basil, tomatoes, that sort of thing.
Wow.
And there are parallels to this hobby with the cycle of life, changing seasons, and medicine as well, and health in general. I mean, a plant requires the right kind of soil, nutrients, sun, shade, watering, just the right amount. So, and it's a very apt metaphor for health itself, which is a complex interplay of many such forces. And I've had my snafus where a lot of my plants have had difficulty surviving. So it's a challenge. I enjoy making little tweaks to my backyard and learning and growing from the experience.
That's great. So who are the beneficiaries of your gardening? Is it just you, or do other folks benefit from it?
It's a small scale household operation. So it's mostly my immediate family, but hopefully it can be scaled up.
That is great. Well, appreciate y'all sharing a little bit about you. Back to you, Kathleen. Tell us a little bit about how you ended up in the nursing field, maybe how you ended up going into nursing school, where you grew up, all that good stuff.
Sure. Maybe some more interesting facts. I was born and raised in Anchorage, Alaska. Wow. I am one of 10 living children. So long winters, very cold nights. And I felt like I was always taking care of someone, whether it be bandaging a scraped knee for one of my siblings or cooking dinner and doing laundry for my mom after she broke her ankle. So caring for others was in my blood very early on. And after I was grown and moved away, I had 5 children of my own. And once they blossomed into young adults, I started to find myself with a lot of free time on my hands. So I would volunteer for numerous nonprofits, working with the less fortunate, and really started to understand the social determinants of health and the impact they can have on an individual's life. After kids were grown and gone, I decided, okay, new chapter. What would I like to do? I've always loved caring for other people, so I found myself heading into the field of nursing. And I started out as an LVN working in skilled nursing facility, doing pretty much business development. I would go on site to the hospitals and do assessments of patients to see if they were an appropriate fit for admission to skilled nursing. And then felt like I really want something more and looked into Vivant Health. At that time, we were River City Medical Group.
Yes.
So I started there in 2016 as a utilization review nurse. And we review cases for our members when they're admitted to the acute, which is the hospital, or post-acute. Maybe it's acute rehab, skilled nursing, LTAC, long-term acute care hospital. So I started there, and then I was asked to move into intensive discharge planning, which was a very robust program focused on ensuring the needs were being met for people prior to discharge from the hospital so that it was a successful discharge and could potentially prevent a readmission. From there, I moved into complex case management, and we had a team of 4 of us, and we worked with the members with very chronic conditions, heart failure, COPD, diabetes. And these members really require a lot of hand-holding, which is what the nurses and social workers were assigned to do. Really enjoyed that. But then the supervisor position opened up. I was asked to apply for that. I did, and here I am today. So my passion for helping others is evident in the work that I do and the company that I work for. I am very proud of Vivant Health and the strides that we've made moving forward in the healthcare industry.
That's great. And it's really cool to see how after kids, you jumped into your career, even though you were caring for many, even as a young lady there in Anchorage. One thing I'm curious, how did you end up moving from Alaska to Northern California?
My family started to slowly relocate to California, and I wanted, of course, to be closer. Once mom and dad made the move, it was time to be closer to my family.
That makes sense. Do you miss the weather in Anchorage at all? Or
I don't. I do miss the cooler temperatures, I will say that, but the night times in the winter, it's dark.
Yes.
You've heard of the land of the midnight sun?
Yes.
So summer is dusk all night long, whereas winters, very dark and minimal daylight hours. So
yes,
I don't miss that part.
That's what I kind of expected you to answer.
Yes.
Well, Dr. Dixit, similar question to you. Tell us maybe a little bit about your upbringing and how you eventually got into medicine and ultimately in the regional medical role you are, or regional medical director role you are today at HealthNet.
I'll take you from the cold, frigid Alaskan winters to the tropical plains of northern India, where temperatures can regularly top 115 degrees.
Oh, goodness.
I grew up in a small rural town in northern India. My parents served as practicing physicians in a small hospital there. So it was quite an adventure for me and my brother to be left alone during nights when both of them were attending emergencies at the hospital. And we didn't understand it at the time. We were, of course, upset. And this was a very different time when kids could be left alone overnight.
Yeah.
But eventually, seeing the long-term relationships that my parents forged with those that they had healed and treated, and some of whom have fond memories of the impact that my parents had on their lives. I mean, that just was very touching, even in those times and to this day. There are friends who come to me and say that, hey, your mom delivered me, and I have vivid memories of my childhood. So it brought home to me the power of relationships in medicine and why people enjoy caring for others, just like Kathleen does. And what a difference, what a gratifying feeling that can be. So that was my introduction to the healing professions, and it was way before computers were all the rage, and medicine was certainly the logical profession for me at the time. I attended medical school in India and completed a residency, practiced over there for a number of years. I saw the complex interplay of various forces on health, environmental forces predominantly, infectious diseases being the predominant burden, a disease burden there, and conditions like typhoid, tuberculosis, various types of intestinal and respiratory conditions. And it brought home to me, in retrospect, the environment and personal choices have a significant role on our health. And primary care done well can make a dramatic impact to the health of individuals. I was attracted to the United States by the technological and all of the innovation that goes on here. If you ask any medical student anywhere in the world, the textbooks that they read are by and large by American physicians. So it was certainly the pinnacle of innovation that attracted me to immigrate to the United States at the turn of the millennium. I started my career here with a residency in Philadelphia.
Okay.
There were two hospitals, a suburban hospital and an inner city hospital, with very different systems of care, very different pathologies, very different modes of care. But the questions were indeed the same. There was that same interplay of environmental factors, of choices, of various complex delivery systems that really attracted me to the health service side of things. I subsequently joined a primary care practice in small town Iowa, a town of about 40,000, where I practiced general internal medicine. I was the provider at a nursing home, in a clinic, and rounded in the hospital. So I did the entire gamut of primary care. And that was a great introduction to the continuum of primary care in all of its diverse settings. Subsequently, I pursued master's programs in public health and healthcare policy and administration. And those were even more eye-opening in terms of the impact that the system has in the way care is delivered, quality is improved, and outcomes are impacted. I was there in Iowa for about 15 years. My son was born there. We just had the loveliest time. People were very gracious. I had a lot of really good, strong relationships. And then a position came about in one of the commercial managed care plans in Iowa, and I was one of the medical directors, where I got to better understand the role of technological innovation, of pharmaceuticals, of all of the cool technologies that were coming into being at the time, about a decade and a half ago. And then I had the epiphany that uh, despite all of the innovation that is at our fingertips, that is available, there are still social drivers of health that our population struggle with, be they transportation or medically tailored meals or health literacy. And those have a powerful impact on health. So I got attracted to the medical side of things and accepted a position at HealthNet a couple of years ago. And this has been truly eye-opening to be able to collaborate with individuals like Kathleen and Vivant Health to try to make a difference in a small way to the health of our populations.
Yeah, awesome. That's a great background. And I'm curious, you mentioned Philadelphia. I was actually there last week. You ever try the cheesesteak? I'm guessing, or maybe not the cheesesteak, but like pizza. What are the foods out there that are famous? Maybe not cheesesteak, pizza. Um, yeah, you
The
probably saw.
hoagies and pierogies, so hopefully
Yeah,
got fast.
yes, I saw the Liberty Bell. So anyway, it's interesting that you mentioned that because I've never been there before. So you've been in India, you've been on the East Coast, you've been in Mid America, and now you're on the West Coast. So you've had quite a journey as Kathleen from Anchorage to Northern California as well. And it's great to hear prior to the show starting that you guys work together, have touched base basically weekly and know each other pretty well. So let's jump in. We'll stick with you, Dr. Dixit, with the relationship between Vivant, HealthNet, and also a project with Dignity. So maybe let's start for the audience that doesn't know HealthNet. Can you give a brief overview of HealthNet as an organization, maybe the different types of lines of business you all have, and then shift into the Medi-Cal work and how you work there in the greater Sacramento area?
Thank you for the question. At HealthNet, we are one of the state's most experienced managed care plans. We serve over 2 million Medi-Cal lives all across the state. And we have products serving various populations, including commercial, marketplace, Medi-Cal, Medicare Advantage, and dual eligibles. We take pride in our commitment to health equity, which goes as far back as 2012, way before health equity was all the rage that it is today. We were on this journey already. And we take great pride in being able to collaborate with our local partners, our community-based organizations, because we believe that high-quality healthcare is best delivered in partnership with local organizations. It helps us deliver care that is culturally and linguistically congruent. And it helps us partner with our members and meet them where they are. So that in a nutshell is what we do here at HealthNet, supporting not just healthcare, but also all of the components that go into health, into producing health, whether it be school-based approaches to health, whether it be affording pregnant women the services of doulas and midwives. So we take a more holistic approach to health than a strictly clinical approach, and that's been just wonderful to be able to support.
Awesome. So you mentioned you partner with community-based organizations, one of them being Vivant. So Kathleen, I'm going to jump over to you. You guys do a lot, right? You're kind of like a CBO, but you're also a medical group, and you guys do a lot. So tell us about Vivant, and actually also you mentioned River City Medical Group, and tell us about the correlation there.
Sure. So we were founded in 1992 as River City Medical Group, and then went through a rebranding to Vivant Health in 2024. We are a trusted leader in healthcare for over 30 years, and we're very proud of that. We're a technology-driven IPA, and we serve approximately 300,000 Medi-Cal and Medicare members. And I would be remiss if I didn't also mention that we have been ranked the number one medical group in the Sacramento area for 5 years in a row. So we're very proud of that, and clearly what we're doing is working. Did you want me to talk about the different lines of business that we are involved in?
That would be great. Yeah, absolutely.
Sure,
And then
sure.
maybe shift into some of your work with Medi-Cal and then with the health net population, and how you guys are both working with Dignity. And I invite Dr. Dixit to jump in afterwards as well.
Okay, sounds good. So Vivant Health is an independent physician association. We are also a Medicare shared savings program, which is known as an ACO. We are involved in women's health services, healthcare technology. We have an ambulatory surgery center. We have University Chest and Sleep Medicine Clinic, which is a pulmonary clinic dealing with members who may suffer from asthma, chronic obstructive pulmonary disease, obstructive sleep apnea. We have University Physical Therapy Clinic so that the members that are able to go to outpatient therapy can attend there. And we serve the Sacramento County area. That's our prime area for our Medi-Cal Health Net members. We went into a program with Dignity Health and Health Net it started in 2022.
Okay.
And I'm going to refer to this as the pilot program.
Gotcha.
And the goal of the pilot program is to reduce hospital readmissions, to reduce unnecessary hospital bed days, and to reduce ER visits, which really were out of control. And the funding for that was just incredible. We put the program into play in February of 23, and we're still going strong. We started with Methodist and Mercy San Juan hospitals. And then last year in February, we added Mercy General Hospital. So we are doing really well with that. We meet weekly, and that's why I was mentioning Dr. Dixit and I know each other very well. Our CMO and Dr. Dixit, along with the directors of case management from the 3 hospitals involved in the pilot program, meet every week with our on-site nurses, and we talk about potential risk for a prolonged hospital stay. We can kind of see the writing on the wall because this is all based on cases we've reviewed in the past. And we brainstorm, come up with potential plans, work with the families, the member themselves, and ensure that we, if possible, are able to reduce that prolonged hospital stay. Because the unnecessary bed days, the prices are astronomical, and it just drives up that healthcare cost. Not to mention, we want to get our members, keep them out of the hospital because they're more prone to infections. Same thing with the ER. You know, we make phone calls to them and talk to the members and let them know there are alternatives to using the emergency room. You have a primary care provider. Many of them aren't aware of that. We let them know the urgent care centers, help get them established with their primary care doctor if they aren't. And we've seen a drastic improvement in the reduction of ER visits, putting all of those things into play.
That's great, Kathleen. Dr. Dixit, I want to invite you in as well. I believe the members or patients we're talking about are specific to HealthNet, correct?
That is correct. 2022 was right around the time that Kathleen was beginning to take off. Our leaders saw an opportunity to improve outcomes for our complex need members who are typically not well served in the current system. Now think about an individual with chronic kidney disease who needs dialysis, who also has a complex behavioral health condition. As a result of an interplay of those 2 conditions, they can have difficulty finding a spot in an outpatient dialysis clinic.
Yeah.
Think about somebody who has a complex physical health condition and a behavioral health condition, very limited family support, and who is not able to navigate the system in terms of setting up appointments, follow-up appointments after their discharge. Or think about someone with a physical health condition who needs to complete their course of antibiotics at a skilled nursing facility and is having difficulty because they also have substance use challenges.
Gotcha.
Now, in all of these cases, Kathleen's team, in partnership with Dignity Health's team and ourselves, was able to ease those barriers for those members, was able to connect them to ambulatory sources of care more quickly than would have otherwise happened. They ensured that the members actually followed up in primary care offices after they were discharged from the hospital. They ensured that members had access to medically tailored meals to help them recover. They ensured that members were able to access recuperative care services before they were strong enough to return to the community. So in all such instances, we were able to leverage the new benefits that our members have through CalAIM and were able to transition a lot of their care seamlessly to the outpatient setting. And that primarily contributes to the success of this program.
That's great, Dr. Dixit. I want to dig in a little bit on the CalAIM initiative, California Advancing and Innovating Medi-Cal. I think most of our audience at this point is familiar with CalAIM. DHCS also refers to like Medi-Cal transformation as a broad term. So you mentioned the different services that through the CalAIM initiative became available. So I want to ask Kathleen or Dr. Dixit, but I'll start with Kathleen. What has happened within Vivant since 2022 that's kind of enhanced your ability to provide some of these services? Are you able to give any more specifics? For example, is it general case management? Is it enhanced case management? Are there any types of community supports you guys do? Can you share a little bit about that? And Dr. Dixit, feel free to jump in as well.
Sure. So we have the combination of ECM, enhanced care management, and community support services. And ECM, the beauty of the ECM team is they are able to do on-site visits when one of our members is admitted to the hospital and talk to them about the program and the different services offered to them. And it could be assistance with housing, food security, maybe mental health services. So the nurse has the ability to develop that one-on-one rapport with the member and then do follow-up with them to ensure that they are aware of upcoming appointments. They're aware of the transportation that is available to them through their insurance plan. Making sure that they attend the appointments, that they understand how and when to take their medications. These are all things that work together. And, I remember somebody telling me one time that if someone is homeless and has diabetes and their blood sugar is out of control, they could care less about the diabetes. They need a roof over their head. Yeah. They need food in their belly. They need access to the medications. How am I going to get there to get my medications? How do I take them? The education that comes with that is so important, and it's provided by these community support services that are offered through ECM. We see that a lot of our members, we work with an extremely fragile population, the Medi-Cal population. It's very challenging. As Dr. Dixit mentioned, we see a lot of mental health issues. We see a lot of substance abuse. And you combine that with homelessness, you've got somebody who is in desperate need of these services, and we're so happy to be able to connect with them and get them the resources they need so that they can better manage their health care.
Awesome. So, Dr. Dixit, I know HealthNet has chosen to engage with Vivant in 2022 or probably beforehand with different different names of case management type services, but now enhanced care management. Anything you want to add about maybe some of the flexibilities that you guys have chosen through the CalAIM initiative, or anything else in general that has been helpful for you?
I would just piggyback on what Kathleen was saying and say that trust is foundational to the way our members engage in their care. And what we have been able to do is show up for those one-to-one in-person visits, reassure them that we are not going anywhere and that we are their partners in their journey towards better health. And that has been truly transformational in being able to close all of these gaps in the system that our members were previously falling through. Enhanced care management, community supports, asthma remediation. So we are going more upstream in terms of addressing the drivers of health. Say medically tailored meals for somebody with a complex heart condition can be life-changing in terms of keeping them out of the hospital, keeping them healthy. So we have been able to move the paradigms of care. We've been able to update some of the clinical protocols that our members experience, and as a result, we have had these improved outcomes.
Awesome, that's great. Now, HealthNet, while your role as a regional medical director is like the greater Sacramento area, correct? Am I understanding that correctly?
Greater Sacramento as well as other geographies.
Okay, yeah. Tell us HealthNet's scope here in California. I know you're part of the Centene Corporation, which is a national organization providing insurance and different Medicaid services, things like that. But here in California, can you tell us a little bit more about where HealthNet is?
We serve various geographies from right here in Sacramento and Northern California, down the Central Valley, also in the LA area and Imperial County. So okay. We serve a broad swath of California counties with our programs and initiatives.
Okay, awesome. You mentioned initiatives. As we get towards the end of today's show, can you tell us, we've learned about what you've done with Vivant and the Dignity Health hospital system there in Sacramento. Are there any other initiatives that you're currently engaged in or looking at the latter half of 2025 and beyond that you'd like to share with our audience, whether in greater Sacramento or just in the state?
One of the initiatives I'm most excited about is scaling up this initiative to additional hospitals right here in Sacramento. Given success, given its tremendous impact on the health of our members, we are excited to be able to partner with other hospitals in the region to drive similar outcomes. So that is absolutely top of mind, and I'm truly thrilled to be able to say that will be a game changer here right here in Sacramento. As far as other initiatives go, we have the whole person care pilot, where we have invested $90 million in partnership with LA Care in field medicine and Skid Row initiatives.
Wow, so that's in Los Angeles, I'm guessing, since you mentioned LA Care. Yeah, okay. Wow, that's a big investment. Okay.
And then we have our maternal health equity initiative, where we are expanding our doula network in the regions that we serve, giving our members access to doulas and midwives.
Awesome. Kathleen, how about you with Vivant? As you guys head into latter half of the year, I know you guys do a lot in greater Sacramento area. Tell us anything else that you think the audience should know about your upcoming work.
Sure. As Dr. Dixit mentioned, we've got the asthma remediation community support program. And this is working with Medi-Cal members with poorly controlled asthma by addressing home-based environmental triggers. The program provides education. They do home assessments and remediation services, such as replacing air filters, allergen-proof bedding, and minor repairs to create healthier living spaces. So we're very excited about that. And we have some upcoming news, very excited to share with you. We're going to be expanding our women's health services in an effort to advance health equity. So stay tuned as we work diligently to provide greater access to high quality healthcare via new and exciting collaborations.
All right, awesome. Well, I'm going to give you guys a little quiz, no pressure. But for the folks listening today or watching, most of our audience does listen. Could you share, if our audience wants to follow the work of Vivant or HealthNet, should they just go to, your website, healthnet.com, for example? Are there other ways they can follow or even get in touch with your organizations for more information?
I would say for Dr. Dixit, were you talking?
Go ahead, Kathleen.
Okay. For Vivant, it's a fantastic website full of lots of information and links that will take you to different articles. I know they've got one that they just recently put on there about the pilot program with HealthNet and Dignity Health. So you can find out more information about that, but it's vivanthealth.com. That's VIVANT health.com.
Awesome. Thanks, Kathleen. And then same question to you. I know HealthNet's a large organization, Dr. Dixit, but any advice you have for folks to follow your work there?
For us, it's healthnet.com. It has a variety of resources for members, providers, and it is up to date with the latest information on CalAIM, ECM, community supports, and all of the benefits that our members have. So I would encourage checking it out.
That's great. Also, folks, I know there's representatives of HealthNet and Vivant at various Medi-Cal events, for example, the PATH Collaborative events there in the greater Sacramento area. So you might run into folks representing these organizations. You can get more information there as well. Before I go and before we wrap up, I want to make sure I have given you all the opportunity to touch base on any initiatives. We've already kind of touched on it a little bit, but I'm about to wrap up. So Kathleen, Dr. Dixit, anything else you think our audience should know today?
I would say,
go ahead, Dr. Dixit. You're going to go first this time.
I would say that the power of improving outcomes for our members is in relationships and in collaboration and partnerships, just like the one we have forged here. The more we interact with each other, the more we share our vision, our bold vision for improving outcomes, the farther we can go. So that's been the eye-opening experience through this initiative. That to drive change, organizations like medical groups, health plans, and providers have to come together to be able to transform the system so that it's more equitable, it's more accessible, and it's more effective for the lives that we serve. Thank you.
Well said. Awesome. And how about you, Kathleen?
Yes, I'd like to piggyback off of that. The pilot program has just really been an eye-opener. We have learned so much, and we continue to learn through troubleshooting. If we try something and it doesn't work, okay, we move on to the next. But we're always focused on the member and how can we best serve them? Because at the end of the day, that's what healthcare is all about, serving others and ensuring that they have the resources they need to live their healthiest life possible. So I think our entire team is extremely passionate about the person. Making money, that's important, and running a business, very important. But at the end of the day, it's all about the patient. It's about the member. It's about the human being. And we truly love what we do.
Awesome. Well, I can tell you love what you do based on your upbringing, Kathleen, Dr. Dixit. I love how you gave your parents a little shout out with the storytelling of the impact they made in India. So it definitely runs through your all's blood. Really appreciate y'all joining today's episode today. Want to thank Amanda at Vivant and then Beatrice and Michelle at HealthNet for helping this all come together on relatively short notice. I did read the press release. I think Kathleen had referenced it earlier today about the work you guys have all done with the Dignity system. Just took maybe like a week or so ago, and we made this happen really quickly. So just really appreciate y'all. Again, folks, we've had Kathleen Loredo from Vivant on today's show, and Dr. Anshul Dixit. Dr. Dixit, did I pronounce your first name correctly?
You did.
All right. That was the first time I said it out loud to you. So really appreciate you guys joining today's episode. And folks, again, VivantHealth.com, HealthNet.com are a great way to follow these organizations. Thank you both for being on today's show.
Thank you so much, Gavin. Appreciate you.
Thank you, Gavin, for this incredible opportunity. We are super grateful.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.